Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Today we're diving into the NAD-NADH ratio, which is a critical biomarker reflecting cellular energy metabolism and redox balance. As doctors and healthcare practitioners, understanding this ratio can sort of guide our diagnostic and therapeutic approaches, particularly in metabolic and neurodegenerative disorders. Let me break it down. Nicotinamide adenine dinucleotide exists in two forms: NAD+, that's the oxidized form, and NADH, the reduced form. The NAD to NADH ratio represents the balance between these two states in cells, primarily in the mitochondria, where it drives ATP production via oxidative phosphorylation. Now, a high NAD to NADH ratio indicates inefficient energy production and favorable redox state, while a low one is oxidative stress or mitochondrial dysfunction or impaired energy metabolism. The ratio is particularly relevant in conditions like chronic fatigue syndrome, diabetes, Alzheimer's, and cardiovascular diseases. For example, a decreased ratio may signal impaired mitochondrial function in neurodegenerative disorders, as NAD+ is critical for sirtuin and DNA repair. Conversely, an abnormally high ratio may indicate excessive oxidative processes seen like inflammation and cancer will. Now, measuring the NAD to NAD ratio typically involves specialized blood or tissue assays and often using high-performance liquid chromatography or mass spectroscopy. We may not do these. They're not routine, but it's not a standalone, and we need to look alongside other clinical things. And so to maximize the utility of NAD to NADH testing, consider simultaneous blood testing, which will give you an idea. Like, for example, lactate and pyruvate levels. They reflect a cellular redox state. And as LDH, lactate dehydrogenase, interconverts pyruvate and lactate using NAD and NADH, an elevated lactate to pyruvate level often correlates with a low NAD to NADH level. Hemoglobin A1C and glucose will assess glycemic control, and dysregulated glucose can cause problems with NAD synthesis. Dyslipidemia may indicate broader metabolic dysfunction and affect NAD pathways. Check CRPs and IL-6, interleukin 6, cause chronic inflammation depletes NAD+. And of course, if you don't have enough niacin, which you could do that level, you'll not be able to synthesize enough of that. Additionally, consider some mitochondrial function tests, like you could do plasma coenzyme Q10. And you certainly always correlate these to the patient's history, symptoms, and other diagnoses. Let me summarize. It is a little bit too much biochemistry, I get it. But in summary, the NAD to NADH ratio offers a window into cellular and redox status. It's critical for diagnosing and managing complex metabolic and neurodegenerative conditions. If you pair it with lactate, glucose, inflammatory markers like CRP and IL-6, you're going to get a lot more information. So integrate this knowledge into your practice and you'll optimize your patient's outcomes. Thank you.